Welcome to Physical and Health Education for JSS 3. Today we study health education, HIV/AIDS awareness. What is HIV/AIDS? HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the immune system, the body's defense against infection and disease. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the advanced stage of HIV infection, when the immune system is severely damaged and the body can no longer fight infections. How HIV is transmitted. 1. Unprotected sexual intercourse, the most common route. HIV is found in semen, vaginal fluid, breast milk, and blood. 2. Sharing of infected needles/syringes, common among drug users who inject drugs. 3. Mother-to-child transmission, MTCT, during pregnancy, childbirth, or breastfeeding. 4. Blood transfusion with infected blood, rare in modern hospitals with screening. 5. Contact with infected blood, through cuts, wounds, or needle stick injuries. How HIV is not transmitted. HIV cannot be spread by handshaking, hugging, sharing food, plates, or utensils, mosquito bites, coughing or sneezing, swimming in the same pool, using the same toilet. Stages of HIV infection. 1. Acute HIV infection, 2 to 4 weeks after infection, flu-like symptoms, fever, rash, sore throat. 2. Chronic HIV infection, clinical latency, the virus is active but at low levels. Person may have no symptoms for years but can still transmit HIV. 3. AIDS, CD4 count below 200 cells/mm superscript 3. The immune system is severely damaged. Opportunistic infections, tuberculosis, pneumonia, fungal infections, become life-threatening. Prevention of HIV. Abstinence, not having sexual intercourse, 100% effective. Be faithful, having one uninfected partner. Condom use, using condoms correctly and consistently. Avoid sharing needles. Safe blood transfusion, ensure donated blood is screened. Prevention of mother-to-child transmission, PMTCT, ARV drugs during pregnancy. Voluntary counseling and testing, VCT. Treatment. There is no cure for HIV, but antiretroviral therapy, ART, suppresses the virus so people with HIV can live long, healthy lives. ARVs are available free at government hospitals in Nigeria through PEPFAR, or U.S. President's Emergency Plan for AIDS Relief, and the National Agency for the Control of AIDS, NECO. Nigeria and HIV/AIDS. Nigeria has one of the largest HIV epidemics in the world, about 1.9 million people living with HIV in 2023. NECO coordinates Nigeria's HIV response. The ABC approach: abstinence, be faithful, condom use. Remember, HIV equals human immunodeficiency virus equals attacks the immune system/body's defense against infection plus disease. AIDS equals acquired immunodeficiency syndrome equals advanced stage of HIV infection equals immune system severely damaged plus body can no longer fight infections. How HIV is transmitted. Unprotected sexual intercourse equals most common route equals HIV found in semen plus vaginal fluid plus breast milk plus blood. Sharing infected needles/syringes equals common among drug users who inject drugs. Mother-to-child transmission/MTCT equals during pregnancy plus childbirth plus breastfeeding. Blood transfusion with infected blood equals rare in modern hospitals with screening. Contact with infected blood equals cuts plus wounds plus needle stick injuries. How HIV is not transmitted. Handshaking plus hugging plus sharing food plus plates plus utensils plus mosquito bites plus coughing plus sneezing plus swimming in same pool plus using same toilet. Stages. Acute HIV infection equals 2-4 weeks after infection equals flu-like symptoms/fever plus rash plus sore throat. Chronic HIV infection/clinical latency equals virus active at low levels equals person may have no symptoms for years equals can still transmit HIV. AIDS equals CD4 count below 200 cells /mm superscript 3 equals immune system severely damaged equals opportunistic infections equals tuberculosis plus pneumonia plus fungal infections. Prevention, abstinence equals not having sexual intercourse equals 100% effective, be faithful equals one uninfected partner, condom use equals use condoms correctly plus consistently, avoid sharing needles, safe blood transfusion equals ensure donated blood is screened, PMTCT equals ARV drugs during pregnancy, VCT equals voluntary counseling and testing. Treatment, no cure but antiretroviral therapy /ART suppresses virus equals people with HIV can live long plus healthy lives equals ARVs available free at government hospitals in Nigeria through PEPFAR plus NOCA National Agency for the Control of AIDS. Nigeria, one of largest HIV epidemics in world equals about 1.9 million people living with HIV, NOCA coordinates Nigeria's HIV response, ABC approach equals abstinence plus be faithful plus condom use. Thank you.